So I bought this, I think they're called Pilates rings, and this is for doing your adduction and abduction. So push it in, hold it for 5 seconds and out again. Push it in, hold it for 5 seconds and out again. And I tend to do 2 sets of 10 reps on this. So do that, do them that way, and then what you have to do is put it together like that, and then you push out for 5, and push out for 5. And once I've done these leg exercises, I mean, as I said, I've taken Celebrex last night, which has helped with the inflammation and bring the pain down a bit. But I find once I've done these, it's I think it must help stretch the hip a little bit and activate the muscles, because I find walking that little bit more easier. Still need a crutch, of course, but I still find it a lot easier once I've done them. And I think, I start the day off doing these every morning. It's not too heavy, it's not too crazy. I've packed in all the other stuff on the weight machines and all kind of stuff. My surgeon just said, Glenn, look, you've got a few weeks left to go, so why cause yourself so much pain? You've been doing exercises and physio for the last 6 months since your last surgery, so knock it on the head, give yourself a rest, and just prepare mentally. And also prepare in terms of nutrition and things like that. It's more important than the last 2 weeks of just moving your legs around and causing yourself pain. So I still like to do them. It gives you a sense of purpose. It's not doing too much harm, it's just creating a bit of pain for myself. But I've only got a week to go now, so I'll do them for a few more days, and then I'll just stop altogether and chill out. These little foot flossers, or whatever you want to call them, nice and easy. Just get the blood flowing a little bit, which is what your blood clots are significant risk in hip transplants. So it's best to try and keep the circulation going as much as you can. I had a bit of cramp overnight in my bad leg, the right side. So I woke up this morning and thought, right, let's do quite a few of these. And I tend to do these quite often. I don't really, I don't sort of count them too many times. I just go, okay, if I'm sitting still or doing anything, I just like to keep flossing like this a little bit. And I find, this is what I'll be doing post-op as well. It's one of the exercises to tell that you need to try and do. So it's best start doing them before some prehab. And I'll show you some of the leg exercises I also do. I used to do it all with resistance band and things like that, and on the weight machines and in the gym, but I'm not doing that now. I'm just doing it non-resistance. I'm just keeping the range of movement and just keeping the muscles activated. 1 week to go. I've done 6 months of physio, so it's now time to wind down and just be gentle on yourself. I used to do these using resistance bands, but I'm just doing some almost like half clamshells, so I don't cause myself too much pain, and I'm just keeping the range of movement, and I'm just keeping the muscles activated. I'll normally do 2 sets of 10 on these, and also straighten the leg right out and keep it as straight as you can. And that hurt a bit. And keep and do them. So again, adduction, abduction, and just do 10 of them as well. So I would normally do 40 straight off the belt. So you do 10 of the clamshell, 10 of the straight legs, and then back to the clamshell, do 10 of them, and normally do it with the resistance bands, but nope, I'm not going to do that. Don't want to hurt myself. I'll just be nice and gentle and do that. And also what I'll do is I'll also do the other side as well, of course, because my left hand side, my left hip has got a bit of arthritis in it, and I've noticed on a lot of these forums that a lot of people have done both sides. I want to try and preserve the left as long as I can. It's not really giving me any pain or anything, so I'm mirroring everything I do on the right to strengthen the right hand side. I'm mirroring it on the other side as well, so I can just try and hopefully last a little bit longer on that. So the last in the series of activations on the legs that I do is the one I hate the most, and the one that tends to hurt the most, but this is what I do. So I always bent leg, straight leg, always start with left side first, which is my good leg to try and just get me into that motion. I used to have the leg straight as possible, knee locked out, bring it up to level with the other one, and then back down again, bring it up to the level of that one, bring it down. And I've just noticed that's just how shiny my legs are and all this. No, I don't shave my legs before you ask. I'm just naturally sexy. So, yeah, let's see. You can see the muscle here. The quads get really activated. And I'll do 10 of them. And then this is where the bit I really don't like. And that is this one. So let's see if this leg is just as shiny. And if you hear me squeal like a girl, so foot up, knee locked, and off we go. Yep, that's fun. Yep, and you hold it for a little while, and you can really feel the quads. And the glutes working a bit here. Yep. And again, nice and sexy legs, nice and shiny. It doesn't seem to be as shiny as that one, I don't know why. But there we go. And I'll do and that's what I'll do. I'll do 10 each side and have a rest, and then do some windscreen wiper washes, and then another 10. And let's get some bridges done. Again, these are recommended pre-op, but also it's something which I'm sure your physio will tell you post-op that you should be doing, because you need to activate your glutes max. So it's push up through the heels and squeeze your arse as tight as you can and hold it for about 5, and down, and then back up again and squeeze in your glutes as hard as you can, and back down again. Now, as you get better at these post-operatively, you can go to one leg and do one-legged again. I've been doing these for a while, so I'm not gonna go back to them now. Not with only a few days left to go. I'm gonna take it nice and easy, and I'll save all the complicated stuff for post-operative side now. I've had my fill of doing physio for the last few months, so I'm just doing my gentle exercises so that I just keep the muscles engaged. And obviously, I'll be walking around before the operation in the next week, and it's just nice to get the muscles activated and get moving a little bit on them. It helps. It hurts a little bit, but I really do think it helps with my walking as well. And Celebrex helps, of course, if you've pushed it a bit hard and you've got a bit of inflammation and a bit of soreness. So, just be careful with the Celebrex as well. And I'll do 20 of these. I'll do 10, then I'll do some little swooshes, and then I'll do another 10. So I used to do this every day, and then I'd go on the cycle on the upright bike. I'd probably do 20 minutes on that, and then I'd go into the gym and do some weights, upper body, and then after that I would either go for a swim or I'd do some more leg work on the weight machines. But after doing that for a few months now, and approaching surgery, again, the surgeon just said, no need, you've done enough, why cause yourself a little bit more pain? Just start to take it easy, wind down. Yep, by all means, do some gentle stuff, which is what I've just demonstrated. And I think if you can do that for the last week or so before you're up, you'll be finding that your post-operative recovery should everybody tells me, and all the videos tell you that it should help you with your post-op recovery. And that's why I'm documenting this, because I'm doing all the stuff that I did, all the stuff that I've been recommended to do. You know, I've watched all the videos, I've listened to doctors and surgeons and blah blah blah, and they all have said this is what you do to a greater or lesser extent. And so I'm going to document it and say, okay, I think the exercises help me post-operatively, because ultimately that's what you're after. You're after the best outcome you can, and so that's what I've been trying to do. So we'll see. Stick with this video for a little while, you know, keep watching the updates as I go through from the op into recovery, and we'll see if it works, and you know, let's see if we can learn something together. I found that since the last surgery, sleep is a bit difficult to come by at times. I had my Celebrex last night. I've done my exercises this morning. I've had a couple of hours of doing and answering emails, etc. So I'm now having an espresso late afternoon. Jesus, I must have had a long nap. It's sorry, it's late morning. You can tell I'm starting to sweat because it's damn hot out there, and. So what I'm going to do is I'm going to do a little bit, and I mean a little bit of upper body. It's not really for the muscles, anything like. It's really for this muscle up here. It's to keep focus and healthy body, healthy mind, so they say. So I'm going to do a little bit of this, just sitting at seated kettlebells and a little bit of weight bench, and then that's it. And then it's lunchtime. This afternoon I've got a lot more emails to do and a lot more work to do, and then later on, I'm building a toilet riser because it's just arrived, and so have a load of other bits and pieces. So I will unbox it all. I love those unboxing things on YouTube, especially when they're golf clubs, but I don't think these are golf clubs. I haven't got much use for them at the moment. So I'll do that. With regards to work, I find that doing the exercises, that keeps me pretty much focused and on track with only a week to go before the op. I'm sure people's mind can sort of wander a bit, but no, I'm focused. So this is what this is really for, and this is what doing these videos is for as well. And you know, let's just crack on with it. I am coming to a hard stop on Thursday night. I've got a lot of meetings tomorrow, which is Wednesday, so a lot of external meetings, and then on Thursday I'm dialing back and I'm doing some conference calls, and then hard stop. And then Thursday night onwards until Tuesday when I go into hospital, it's focused on me and the wife. Prepare the house because there's quite a bit of stuff to do, and I've got to unpack and build a few things, but I'll do that. But it really does need. I'm jumping all over the place. Yeah, I'll just get you dizzy. How to get you dizzy in 101. So that's where I am right now. Working through Thursday night, hard stop, focus on me and the wife, get prepared for next week. I think that's very important to recovery. So let's just do it, and let's document it and see how it goes.
Thank you. Thank you. Thank you.